A doctor admitted on social media that having undergone breast cancer treatment, she wished she was aware of this specific issue relating to breast cancer surgery. What was this? Let's find out. She wished she knew the collateral damage that breast cancer surgery can give. Allow me to repeat her statement. Having already had her surgical treatment, she wished that as a breast surgeon, she was aware of all the collateral damage that breast cancer surgery can give. If you wish to avoid this situation and want to know the truth about the collateral damage of breast cancer surgery before undergoing treatment, stay tuned as I unpack in this video the facts which research has uncovered. As this information is for patient education, please consult your doctor for treatment planning specific to your unique circumstances. Breast cancer surgery may be classified into two broad groups: breast conservation treatment and mastectomy. Breast conservation treatment involves the removal of the cancer with a rim of normal tissue around it and retaining the healthy breast tissue. This is usually followed by radiotherapy. Surgery can also be referred to as lumpectomy, wide excision, and partial mastectomy. The other broad group of surgical treatment involves the removal of the breast, also known as mastectomy. Women may elect to undergo reconstruction, either immediately after mastectomy or later. There are many consequences of breast cancer surgery, and they would fall within these 6 groups. In today's video, I will explore the first 5 topics. We begin with post-operative events. Early post-operative complications are those which occur within the first 30 days after surgery. As we see, for partial mastectomy or lumpectomy, overall complications occur in 1.74% of patients. This is significantly lower than women who undergo simple mastectomy without reconstruction, where the overall early complication rate is 4.04%. The percentage of women who opt for mastectomy with reconstruction and experience early postoperative complications may vary in reports from different centers. This team of Japanese doctors reported postoperative complication rates for nipple-sparing mastectomy and implant reconstruction to be approximately 20 to 30%, with those requiring additional treatment to be about 10 to 12%. Here, a team of doctors from Australia reported a complication rate of 58.9% for women who underwent skin-reducing mastectomy and implant reconstruction. Early postoperative complications which occur during the first 30 days of breast cancer surgery may be considered collateral damage. This is a recap of the reported complication rates according to the type of operation. Women who underwent breast-conserving surgery had a risk of 1.74%. Mastectomy without reconstruction was associated with a complication risk of 4.04%. while up to 58.9% of women who undergo mastectomy with reconstruction may suffer complications. Having discussed early postoperative complications, I will now share the published data about delayed revision surgery. Some issues related to treatment may occur months or years after therapy. This team of doctors reported that for women who underwent skin-reducing mastectomy with reconstruction at their center, patients may require long-term revision surgery. The most common of these repeat operations was to correct capsular contracture related to the implant that occurred months to years after treatment. The choice of surgery has an impact not only on survival and recurrence, but also on the quality of life during survivorship. At this point, I will share the data on survival rates, which is a surrogate for cure, that compares breast conservation treatment and mastectomy. A meta-analysis is a statistical comparison of 2 forms of treatment based on combined data from research studies on the same condition. There is a large number of studies similar to this one led by Dr. Fulginiti, which demonstrate significant benefits of breast conservation on overall survival when compared with mastectomy. Seen from another perspective, it can be said that the survival time of patients who underwent breast-conserving surgery was significantly longer than that of patients who had a mastectomy procedure.
So, what could the collateral damage be in this case? If mastectomy was performed, there may be poorer survival rates, which could also be interpreted as shorter survival time.
Another common concern is the risk of local recurrence. What does research data show? In this study published in 2025 and conducted at the MD Anderson Cancer Center, the researchers found that patients who underwent total mastectomy with or without radiotherapy had similar rates of local regional recurrence compared with those who underwent breast-conserving therapy. The data shows that there is no difference in local recurrence when comparing breast conservation treatment and mastectomy. So it can be said that neither procedure is associated with collateral damage in terms of local recurrence. Let us now look at quality of life after breast cancer surgery. CPM in this study is the abbreviation for contralateral prophylactic mastectomy. This means that the patient underwent a mastectomy for the affected breast and chose to remove the other breast as a preventive measure. This is commonly referred to as double mastectomy. In this study, some young women who chose to undergo double mastectomy because they did not wish to take chances had physical and emotional challenges after surgery for which they did not feel prepared. Body image was a concern, and a proportion of women indicated some treatment-related regret attributed to surgery. The issue of body image is consistent with the findings of this study conducted in Sweden that up to half of the women who underwent double mastectomy reported feeling less sexually attractive, had dissatisfaction with their bodies, and dissatisfaction with their scars. In contrast, if we were to look at the data on breast conservation therapy, we have a study conducted at Memorial Sloan Kettering Cancer Center, which showed that breast satisfaction and quality of life scores were higher for breast-conserving surgery compared to mastectomy with implant reconstruction in early-stage invasive breast cancer. Here is a list of a few quality-of-life issues which are reported by women who underwent mastectomy or double mastectomy. They can be viewed as collateral damage, and women who undergo these procedures may wish to be aware of the possibility they might encounter them during survivorship. This is a brief summary of the potential points of collateral damage which a patient may encounter as she progresses in her surgical treatment journey. Most of them are related to mastectomy and reconstruction. This is one of the reasons why an expert panel that convened at the 2025 edition of the St. Gallen International Breast Cancer Conference believed that patients diagnosed with early breast cancer should be advised that breast-conserving surgery and radiation therapy is usually the best treatment option. Did you want to know what type of surgery the breast surgeon I referred to earlier underwent? Please write a comment if you wish to do so. Thank you for staying until the end of the video. Please note that the list provided in the previous slide is by no means exhaustive. However, I hope it would help patients avoid the situation which one breast surgeon lamented about, that she wished she knew the collateral damage breast cancer surgery can give. If you have questions about what other complications or problems a patient may face in her survivorship after completing breast cancer surgery, please list them in the comments section and I will answer them as soon as I can. Kindly click the like button, share, and subscribe if you have found the information useful. As always, the content in this channel is intended to empower women to make choices which help them live longer and live more after breast cancer treatment. I hope you will join me in my other videos as well. Until we come together again, take care.